Hello, my name is Enrique Grande. I'm medical oncologist at the MD Anderson Cancer Center in Madrid, and I had the privilege to present the results of a post-hoc analysis that we did on the IMvigor130 trial. We know that we need clinically relevant biomarkers to select which is the best treatment for our patients with metastatic urothelial carcinoma. We are using PD-L1 expression. We are using that in the clinic. We are using that to select patients or to stratify patients in clinical trials. But unfortunately, there are a lot of heterogeneity in how we are calling patients PD-L1. We are using different testings. We are using Ventana, we are using DACO. Inside of Ventana, inside of DACO, different antibodies binding to different epitopes of the PD-L1 molecule. In addition to that, we know that primary tumors are expressing differently PD-L1 than metastases, and in addition to that, there is also another heterogeneity in the sense that the expression of PD-L1 is not exactly the same in the different parts of the tumor samples, but there is heterogeneity in the distribution of the expression of PD-L1. Moreover, there is a time difference expression of PD-L1. So one tumor can express PD-L1 at the beginning, can lose this expression, and can recover the expression of PD-L1 in time. And lastly, there is heterogeneity in the pathology review of this PD-L1 testing. So there is a broad heterogeneity of what we call PD-L1 positive. In the phase 3 trials that we have reported recently, we have a range of PD-L1 positive patients coming from down to 23-25% in the IMvigor130 up to 60% in the Danube trial. So we need to unify the definition of what we are calling PD-L1 patients, otherwise we will be comparing apples and pears here. This post-hoc analysis that we are presenting here at ESMO 2022, we were reporting that 25% of the patients, according to the SP142 Ventana testing, were positive for PD-L1 expression, while 35%, 10% more, were positive according to the 22C3 DACO analysis. This 10% of difference is making a difference in the outcomes for survival of patients. Well, it was shown that yes, there was a prognostic significance here, and those patients treated with atezolizumab only, there was a significant difference in the prognosis of what we were calling PD-L1 positive, if we were calling PD-L1 by SP142 or by 22C3. This is clinically relevant. Well, I think it is, because we are selecting patients with a median expected overall survival of 27.5 months, according to the PD-L1 positivity by SP142. However, the median survival for patients PD-L1 positive, according to 22C3 staining, was much lower. When we compare the data of the outcome of patients according to the expression of PD-L1 with the two antibodies of patients who receive atezo versus chemo, there was not only a prognostic significance differences, but at the same time there were also a kind of prediction, or SP142 can predict the activity of both chemotherapy and atezolizumab in this field. This is the most important part. Lastly, we observed that those patients positive for the both tests, for SP142 and 22C3, they had the longest survival when treated with atezolizumab alone. And that was not that much clear when the patients were treated with chemotherapy. Consistently, those patients positive for PD-L1 expression by 22C3, but negative for SP142, this 10% of the patients difference, they did worse with both atezo, monotherapy, and chemotherapy. Probably this is a matter of which immune cells the both testing are really staining. This is the major difference here, because the immune cells positive for PD-L1, the subtype of immune cell positive for PD-L1 is really mattering in the field of prognostic and prediction to receive immunotherapy. As a conclusion, probably the SP142 staining immunohistochemistry process is selecting better those patients that will be benefiting at least from receiving atezolizumab according to this post-hoc analysis that we perform. Should we use this test in the clinic? If we want to be the more specific, the more sensitive to select this patient scenario, probably this is the ideal. Thank you. Thank you so much.